Have you been prescribed Methotrexate for your rheumatoid arthritis but you are not exactly sure why? Or maybe you are wondering how it works and what to expect from this medication. If you got these questions on your mind, keep on watching. Hi, this is Dr. Ananta Subedi, your rheumatoid arthritis coach at the Room Doc. Today, we are diving into one of the most commonly prescribed rheumatoid arthritis medication called Methotexate. And I'll be going over some of the commonly asked questions from my patients about Methotexate. We'll be talking more on how it works and what to expect from this medication. Let's get started. Methotexate has been considered a cornerstone in the treatment of rheumatoid arthritis for decades. It's what we call a disease-modifying anti-rheumatic drug for short. Many of you might be asking, why do I need to take Methotexate? Methotexate is often prescribed to reduce inflammation, ease pain, and slow down the progression of joint damage due to rheumatoid arthritis. It is usually the first medication recommended when RA is moderate to severe because it has a proven track record of effectiveness and long-term safety if monitored closely. Now, the next question that I commonly hear is how exactly Methotexate works for you in rheumatoid arthritis. As many of you know, rheumatoid arthritis is due to a hyperactive immune system where it mistakenly attacks your joints. Methotexate steps in and calms down that overactive immune response. It works by minimizing the overproduction of inflammatory molecule called cytokines by decreasing the activity of the immune cells in your joint fluid. You can think of it as quieting the internal fire that is causing your joint pain and inflammation. Now, other very important question that I get is what can I expect in terms of benefit from Methotexate? First, it can significantly reduce joint pain, swelling, and which means less discomfort for you in everyday activities. It also helps improve your physical function, meaning you are in less pain and you are more functional on what you want to do. Most importantly, Methotexate slows down the progression of joint damage due to rheumatoid arthritis. The sooner you start the treatment, the better the chances of maintaining joint health and preventing permanent joint damage. Now, the other question that many of you might have in your mind is how long before I feel better on Methotexate? Unfortunately, Methotexate is not an instant, quick, easy fix. You might start noticing improvement in as little as 3 to 6 weeks, but it can take up to 12 weeks to feel full benefit of Methotexate. It's also important to stay patient and give your body time to respond to this medication. In the meantime, your doctor may adjust your dose to help you get to the best results. Now, the next other common but important question to consider is what are the potential risk and long-term effect of Methotexate? While they are rare, long-term use of Methotexate can potentially cause liver damage if they are not monitored properly. Lung inflammation and higher risk of infection are also not uncommon. That's why regular blood tests and checkups are critical when you are taking this medication. These tests help catch any potential issue early so that you can continue treatment safely or change the dose of the medication. But keep in mind that most people do well on Methotexate over long term, but regular monitoring is the key. Now, you might be wondering, how will this medication affect your daily routine? For most people, Methotexate does not drastically change your day-to-day life. You will need to take it weekly and attend regular doctor visits and blood tests. If you drink alcohol, you will want to limit it or even avoid it. And women in their childbearing years need to avoid pregnancy while on this medication. So a very effective contraceptive method is very important on this medication. Now, rheumatoid arthritis being a chronic condition, you might be wondering, will you need to be on Methotexate forever? If it is working for you well, it is likely that you will stay on this drug for a long period of time to maintain the disease under good control. However, your treatment plan may change based on how your body is responding to the medication and other factors in your health. Most of the time, your rheumatologist will prescribe you a higher dose of Methotexate in the beginning, and as the RA gets better, you can lower your dose of the medication in consultation with your rheumatologist. Now, you might be wondering, are there any other alternative to Methotexate? When it comes to rheumatoid arthritis treatment, Methotexate often stands out as the first choice. It is effective, has a reasonably good safety profile, and is more affordable compared to other biologic medication. So it's a great option for many patients managing rheumatoid arthritis. Most of the insurance plan also require the use of Methotexate prior to going on other biologics, as they are considered to be effective option. But a lot of it depends on your overall health, your insulin plan, and your choice of the medication. Now that we have covered the basics of rheumatoid arthritis and methotrexate, and I have answered a lot of your questions, one thing to keep in mind is that there is no one size fit all. When we manage rheumatoid arthritis, a lot of depend on your preference, your doctor preference, your insurance plan preference. Your treatment journey is unique, and it's important to work closely with your rheumatologist to find the best care available for you. And I'm very excited to share that my book, The Holistic Rheumatoid Arthritis Guide, will also provide you all the resources that you need to take better care of your rheumatoid arthritis that include medical treatment and other holistic approaches. And if you like a free sneak peek of the book before it launches, just comment the word book below and I'll send you a special preview of the book. If you found this video helpful, be sure to like, subscribe, and share it with someone who might benefit. This is Dr. Ananta Subedi, your rheumatoid arthritis coach. And remember, RA may have attacked you, but don't let it defeat you. Together, we will find your path to living well with rheumatoid arthritis to find the best life possible. Bye-bye.